Have you ever wondered why you have done everything right? You take your medication on time. You attend follow-up appointments regularly. You follow your doctor's advice for many years. But then one day, you start to feel tired more quickly. Your heart feels unusual when you lie down at night. When you stand up, you feel slightly dizzy, and a very familiar thought appears in your mind. Maybe this is just old age. Most people over 60 believe the same thing. And it is precisely this belief that is hiding a truth that cardiac surgeons in the United States can no longer ignore. Inside the operating room, they are seeing hearts that should still be stable for a person's age, but in reality, they are not. The heart muscle is becoming weaker. Signs of inflammation are rising. Heart rhythm disturbances appear without any clear cause related to lifestyle. When doctors trace the medical records backward, the common factor is not what patients eat or whether they exercise. The common factor is familiar medications. Medications that are legally prescribed. Medications that many people believe are completely safe simply because a doctor prescribed them. But modern cardiology has revealed something very different. After the age of 60, the body no longer processes medications the way it once did. The liver clears toxins more slowly, the kidneys filter less effectively, and the heart becomes more sensitive to small changes that it could easily tolerate before. Large studies published in recent years in respected cardiology journals show that some commonly used medications may increase chronic inflammation, disrupt heart rhythm, and raise the risk of cardiovascular events in older adults. What is most concerning is that most of this damage happens quietly. There is no severe pain. There are no clear warning signs, until the heart has been weakened for a long time. In this video, I am not encouraging you to stop taking your medication on your own. I am also not saying that your doctor is wrong. What I want to do is help you understand the risks that very few people explain clearly, so you know the right questions to ask, so you can protect your heart before it is too late. If this is your first time watching this video, please follow the channel. We share health analysis designed specifically for people over 60, information that is often difficult to hear fully during a clinic visit. And now, let us move into the list of medications that may be quietly affecting the hearts of many older adults. Type 7. Proton pump inhibitors for the stomach, safe in the short term, but risky when used long term. Many people over 60 feel reassured when they take stomach medication every day. No pain, no heartburn. Eating feels more comfortable. And because the medication is legally prescribed, they believe long-term use must be harmless. But in cardiology, stomach medications in the proton pump inhibitor group are among the drugs that many doctors have begun to worry about when patients use them continuously for many years. Proton pump inhibitors work by strongly reducing the amount of acid in the stomach. In the short term, this is very helpful for acid reflux, ulcers, and gastrointestinal bleeding. Problems begin when the medication is taken continuously for a long period without being reevaluated. Stomach acid is not only for digesting food. It also plays an indirect role in many absorption processes and in protecting blood vessels. This is especially dangerous for older adults who already have high blood pressure, coronary artery disease, or hidden heart failure. What is striking is that many people over 60 take proton pump inhibitors for many years without ever being asked a simple question: do I still truly need this medication every day? The good news is that not everyone needs to stop the drug. For many people, lifestyle adjustments alone can significantly reduce stomach symptoms. Eating dinner earlier, not lying down immediately after meals, raising the head of the bed when sleeping, modest weight loss if overweight. In cases where medication is still needed, other acid-reducing drugs with a gentler impact on the cardiovascular system may be considered. The most important step is regular reassessment. Not because the medication is bad, but because your body after 60 is no longer the same as before. If you are taking stomach medication every day and also have high blood pressure, heart fatigue, or mild palpitations at night, this is the right time to talk with your doctor again. Not to stop the medication, but to make sure your heart is not quietly paying the price for short-term comfort. Type 6. Fluoroquinolone antibiotics, a little-known blood vessel risk. There is one group of medications that many older adults have taken at least once in their lives. These are antibiotics. And because antibiotics are usually taken for a short time, most people believe that taking just a few pills cannot possibly harm the heart. But with one specific group of antibiotics, cardiology has been forced to issue warnings. That group is fluoroquinolones. These medications are commonly prescribed for urinary tract infections, sinus infections, pneumonia, or skin infections. They are powerful, they penetrate deeply, and they kill bacteria very quickly. The problem is that their effects do not stop with bacteria. Large studies published in respected cardiology journals in the United States show that in people over 60, fluoroquinolones are associated with an increased risk of aortic aneurysm and aortic dissection. This is the largest blood vessel in the body. When the vessel wall becomes weakened, even a small trigger can lead to severe consequences, including death. Beyond blood vessel structure, this group of drugs also affects the electrical system of the heart. Fluoroquinolones can prolong the QT interval. This is a small change seen on an electrocardiogram, but it can lead to dangerous heart rhythm disturbances in older adults. In rare but serious cases, it can cause life-threatening arrhythmias. The message here is not to refuse antibiotics. It is to ask the right question. If your doctor suggests a fluoroquinolone, especially when you are over 60 and have heart disease or high blood pressure, asking whether there is a safer option for the heart is completely reasonable. This is not questioning your doctor. It is cooperation to protect the heart in a body that has changed with age. Sometimes, just a short conversation is enough to help you avoid a risk you were never warned about before. Type 5. NSAIDs, pain relievers that increase blood clotting risk. Many people over 60 see pain relievers as a lifeline for daily life. Knee pain, take one pill. Back pain, add another. Aching joints when the weather changes, use them for a few days to feel more comfortable. And because these medications are widely sold and very familiar, few people think they could be dangerous for the heart. That group of medications is called NSAIDs. NSAIDs reduce pain and inflammation very quickly, but the price is paid by the cardiovascular system, especially when they are used frequently or over a long period in older adults. Large analyses involving hundreds of thousands of patients show that NSAIDs significantly increase the risk of heart attack, stroke, and heart failure. What is concerning is that this risk does not appear only with high doses. It can begin after just a few consecutive days of use. The mechanism lies in blood vessel imbalance. NSAIDs block substances that protect the vessel walls and support natural anti-clotting processes. When this protective layer weakens, blood becomes more likely to clot. Blood pressure rises slightly but persistently. The heart must pump under higher pressure every day. In younger people, the body can still compensate. But in people over 60, the heart and blood vessels are less elastic. Even a small change can become a major burden. Another effect that receives little attention is fluid and salt retention. NSAIDs cause the body to hold more water. In the afternoon, the legs may become mildly swollen. In the evening, there may be a heavier feeling in the chest when lying down. These are signs that the heart is handling extra blood volume. Many people do not connect these symptoms to pain medication. They assume it is aging, less activity, or the weather. But in real clinical practice, many cases of heart failure worsen noticeably, simply because NSAIDs are taken regularly for joint pain over many months. This does not mean that older adults should never use NSAIDs. The issue is how they are used. Short-term use, the lowest effective dose. Avoid continuous use unless truly necessary, and be especially cautious if you have a history of high blood pressure, coronary artery disease, or heart failure. If you are taking pain medication almost every day and notice increased fatigue, mild leg swelling, or more shortness of breath than before, that is the moment to pause and reassess. Not because you are becoming weaker, but because your heart may be carrying a silent burden that very few people warn you about from the beginning. Type 4. Older diabetes medications, controlling blood sugar but sacrificing the heart. When it comes to diabetes, most older adults are told one main thing: blood sugar must be kept very low. And because of that goal, many people have taken the same medication for decades without ever asking further questions. The problem is that not all diabetes medications affect the heart in the same way. This group of medications can easily cause low blood sugar. When blood sugar drops too low, the body reacts as if it is in danger. Adrenaline levels rise, the heart beats faster, blood pressure fluctuates. In younger people, this reaction is usually brief, But in older adults with less elastic blood vessels, it can trigger heart rhythm disturbances or silent episodes of reduced blood flow to the heart. Not only that, several long-term studies show that some older diabetes medications are associated with a higher risk of cardiovascular death compared with other treatment options. The heart is exposed to repeated stress every time blood sugar rises and falls unpredictably. What is concerning is that many people take their medication faithfully and see good blood sugar results on tests, yet feel tired more quickly. Climbing stairs causes more shortness of breath than before. At night, the heartbeat feels irregular, and they never suspect that the cause could be the very medication helping them control blood sugar. The message here is not that older medications are always bad. It is that your body has changed, and a drug that was suitable 10 or 15 years ago may no longer be the best choice for your heart today. If you are being treated for diabetes and notice reduced stamina, increased heart fatigue, or have experienced mild low blood sugar episodes, this is the time to talk with your doctor again. Not to change medication on your own, but to make sure the treatment goal is not only a blood sugar number, but protecting the heart and preserving long-term independence. Type 3. Sleeping pills. You can sleep, but the heart does not rest. Insomnia is one of the most common complaints among people over 60. Difficulty falling asleep, waking up in the middle of the night, waking up still feeling tired. And when this continues for a long time, many people choose the fastest solution, taking a sleeping pill. At first, the medication helps you fall asleep more easily. Nights feel calmer. It feels as if the body has finally rested. But what very few people are clearly told is this: sleep created by medication is not the same as the natural sleep the heart and brain need. Some commonly used sleeping pills suppress the breathing center. Breathing becomes slower and more shallow during sleep. Blood oxygen levels drop, especially in people who already have undiagnosed sleep apnea. The heart is forced to work under repeated low oxygen conditions throughout the night. Another danger is lingering grogginess that carries into the next day. Standing up a little too quickly can cause dizziness. A small misstep can lead to a fall. In older adults with heart disease, a fall that leads to hospitalization can become a trigger for serious cardiovascular events. Many observational studies in older adults show that long-term use of sleeping pills is associated with a higher risk of death, with cardiovascular events accounting for a significant portion. Not because insomnia itself is more dangerous, but because the way we deal with insomnia can sometimes be more harmful than the problem itself. What is often overlooked is that sleeping pills do not address the root cause. They do not improve the body's natural sleep rhythm. They do not help the heart and brain coordinate better during sleep. They simply switch you off for a few hours. There are safer, heart-friendly approaches. Going to bed and waking up at the same time every day. Keeping the bedroom cool, dark, and quiet. Avoiding bright screens before bedtime. Reducing coffee intake after the morning hours. Small changes like these can improve deep sleep without forcing the heart to pay a price. If you are using sleeping pills regularly and notice increased fatigue, nighttime palpitations, or frequent dizziness when waking up, this is a signal to reevaluate. Not to stop medication on your own, but to find a way to help you sleep better while allowing your heart to truly rest. Type 2. Antipsychotic medications. Black box warnings for older adults. There is one group of medications that even cardiologists become especially cautious about when they see the name appear in the medical records of an older patient. These are antipsychotic medications. Many people believe these drugs are used only for severe psychiatric illnesses, but in reality, people over 60 may be prescribed antipsychotics for many other reasons: agitation, severe insomnia, behavioral disturbances related to dementia, or simply to keep the patient calm. The problem is that the aging heart does not tolerate this group of medications as well as we once believed. Large studies involving tens of thousands of older adults show that antipsychotic medications significantly increase the risk of death, with cardiovascular causes accounting for a large proportion. Heart rhythm disturbances, sudden cardiac death, stroke. These events occur far more frequently in people taking these drugs compared with those who do not. One of the most dangerous mechanisms is their effect on the heart's electrical system. Antipsychotic medications can prolong the QT interval. When the heart rhythm is abnormally prolonged, the risk of dangerous arrhythmias rises sharply, especially during times of fatigue, dehydration, or when combined with other medications. In addition, many drugs in this group cause orthostatic hypotension. When the person stands up, blood pressure drops suddenly. The heart cannot adapt quickly enough. Dizziness appears. The risk of falls increases. And as mentioned before, in older adults with heart disease, a fall that leads to hospitalization can trigger a cascade of serious cardiovascular events. Antipsychotic medications also strongly affect metabolism. Weight gain, higher blood sugar, elevated cholesterol. These three factors together create an extremely unfavorable environment for blood vessels and the heart in older adults. What is concerning is that, despite strict warnings, this group of medications is still used quite commonly in long-term care settings, not because they are safe, but because they are convenient. In many cases, agitation or sleep disturbances in older adults do not originate from psychiatric illness. They come from pain, hidden infections, constipation, dehydration, or simply a stressful living environment. When these underlying causes are addressed, many behavioral problems improve without the need for antipsychotic medication. The message here is very clear. Antipsychotic drugs are not a safe long-term solution for people over 60, especially those with heart disease. If you or a loved one is taking this type of medication and experiencing increased fatigue, dizziness when standing, irregular heartbeat, or rapid physical decline, this is a sign that reassessment is needed. Not to place blame, but to make sure the heart is not silently carrying a risk that has already been clearly warned about in modern medicine. Type 1. Opioids, the most dangerous silent killer of the heart. If there is one group of medications that makes cardiac surgeons most uneasy when reviewing the medical records of older adults, it is opioids. These powerful pain relievers are commonly prescribed for chronic back pain, severe joint pain, post-surgical pain, or persistent pain that prevents normal daily activities. When first used, opioids can make patients feel more comfortable, sleep better, and temporarily forget the pain. But for the heart of someone over 60, the price can be very high. Large-scale studies in the United States show that long-term opioid use in older adults is linked to a significantly higher risk of cardiovascular death. This risk is especially high during the first months of use and continues to rise as the duration of treatment increases. One of the most dangerous mechanisms is respiratory suppression. Opioids slow breathing and make it more shallow, especially during sleep. Blood oxygen levels fall. The heart is forced to function under repeated low oxygen conditions night after night. For an aging heart, this is an enormous strain. In addition, opioids disrupt the autonomic nervous system, the system that controls heart rate and blood pressure. When this system is disturbed, the heart loses its ability to adapt smoothly to stress. Heart rhythm becomes less stable. The risk of arrhythmias and sudden cardiac death rises. Studies also show that people who use opioids long-term tend to have higher levels of inflammation in the body. This chronic inflammation accelerates atherosclerosis, reduces blood vessel elasticity, and gradually weakens the heart muscle. Many patients do not experience classic heart attack symptoms or severe shortness of breath. They simply feel their strength fading more quickly and assume it is just aging. The danger is greatest when opioids are combined with other medications commonly used by older adults. Combined with sleeping pills or sedatives, the risk of respiratory failure increases several-fold. Combined with heart medications, rhythm disturbances can worsen. Combined with blood pressure medications, dangerous drops in blood pressure can occur when standing up. Sadly, many older adults fall into this cycle without realizing it. Opioids for pain, sleeping pills for insomnia, heart medications for fatigue. Each medication has a reasonable purpose, but together they create an overwhelming burden for the heart. The most important message here is not to fear opioids. In some cases, they are still necessary. But for people over 60, opioids should not be a long-term solution for chronic pain when other options exist. If you or a loved one are using opioids regularly and notice increased heart fatigue, shallow breathing at night, dizziness when standing, or rapidly declining endurance, these are signs that should not be ignored. Not to stop medication on your own, but to have an open and honest conversation with your doctor. Because in many cases, heart damage from opioids is not inevitable. It happens when patients are not warned early enough. Drug interactions. The real danger is not one pill. Many people over 60 often say something very familiar to me. "I am not taking strong medications, doctor, just one pill of each." And that exact sentence hides one of the greatest dangers to the aging heart. The problem is not a single pill. It is the combination of many pills inside a body that is changed with age. After the age of 60, most Americans take between 5 and 10 medications every day. Blood pressure medication, diabetes medication, stomach medication, sleep medication, pain relievers. Each one may be prescribed correctly, but when they enter the body at the same time, their effects are no longer simply added together. They amplify one another. In cardiology, this is known as the cumulative risk effect. Here is a very common example. A person takes opioid pain medication to manage chronic pain. At night, they add a sleeping pill to help them rest. Each medication on its own may have been carefully considered, but when taken together, both slow down breathing. Oxygen levels in the blood drop during the night. The heart is forced to work under prolonged, low oxygen conditions. This is especially dangerous for people who already have coronary artery disease or hidden heart failure. Even medications that seem harmless, such as stomach acid reducers or mild sedatives, can cause problems when combined with heart medications that slow the heart rate or drugs that affect the heart's electrical system. Small rhythm imbalances, when repeated over time, can significantly increase the risk of atrial fibrillation and other dangerous arrhythmias. Studies on multiple medication use in older adults show that the risk of hospitalization for cardiovascular events rises sharply when the number of daily medications exceeds 5. What is concerning is that very few patients are clearly informed about this risk. Each doctor looks at one piece. Very few look at the entire picture. So the most important question is not, what medications am I taking? It is, how are these medications interacting with each other inside my body? If you are over 60 and taking more than 3 medications each day, especially sleep medications, pain relievers, or heart drugs, this is something you should not ignore. Not to create fear, but to be proactive, to know when to ask questions, and to make sure your heart is not silently paying the price for interactions you were never warned about. Chronic inflammation caused by medications, the silent destroyer of the heart. There is something that many people over 60 are rarely told clearly. The heart rarely weakens because of a sudden event. More often, it is slowly worn down by a much quieter process. That process is chronic inflammation. Inflammation does not always cause pain. You do not feel sharp aches. You do not have a fever. You do not need to be hospitalized. But inside the blood vessels and the heart muscle, inflammation is happening day after day. In modern cardiology, chronic inflammation is considered a foundational driver of heart failure, atherosclerosis, and heart rhythm disorders in older adults. What is concerning is that some commonly used medications can gradually fuel this inflammatory fire over time. The most dangerous part is that chronic inflammation does not trigger early warning signals. You may just feel a little more tired. Walking at a faster pace leaves you more short of breath than before. Your legs feel slightly heavy in the afternoon. At night, your heartbeat feels less regular. Many people reassure themselves that this is simply aging. But in real clinical practice, these are often signs that the heart is being forced to work in a prolonged inflammatory environment. The message here is not to fear medications. It is to understand that long-term medication use can create a silent inflammatory state if it is not properly monitored and adjusted. If you have been taking pain medications, sedatives, or multiple medications at the same time for many years, paying attention to unusual fatigue, mild palpitations, or reduced endurance is not overreacting. It is how you listen to your heart before damage becomes obvious. Protecting the heart before it is too late. After the age of 60, the heart does not weaken simply because of time. In many cases, it becomes fatigued from carrying long-lasting, silent burdens that were never fully explained to us. Familiar medications may have helped you feel more comfortable during certain stages of life, but over the years, those same medications can become a burden if they are not carefully reviewed. The most important thing I want you to remember today is not to fear medication. It is to understand it. To understand that your body has changed, and that a prescription from 10 years ago may no longer be the best match for your heart today. If after watching this video, you begin to re-examine the medications you are taking and ask a few more questions during your next visit with your doctor, then this video has done its job. The heart has a remarkable ability to adapt when it is protected in the right way and at the right time. If this is your first time watching, please follow the channel to continue receiving health insights designed specifically for people over 60, the kind of information that is often not fully explained in a clinic visit. And if you found this video helpful, please share it with someone you care about. Sometimes, the right understanding alone can save a heart.